Good night. I'm going to talk about nurses. Nursing grades. Nurses working in a hospital have the following grades. Student nurse. This is a nurse who is still in training. A staff nurse. A nurse who has completed the training course. Charge nurse. A more experienced nurse who is in charge of or responsible for a guard or department. Nurse manager, a nurse who is in charge of several squads. Note, the old term sister is still sometimes used for female charge nurse. A female nurse manage may be called matron. Dr. James is talking to Sister Watkins. Workers. The clinical support workers who has done a short course and obtained basic qualification, and the nursing auxiliary who is usually unqualified but both assist nursing staff. There may also be guard clerks whose duties included making sure patients' notes and information are up to date and answering the telephone. Specialization, like doctors, nurse can specialize. A midwife has specialized from the beginning by doing a course in midwifery, the management of pregnancy and childbirth. District nurses visit patients in their homes, and health visitors also work in the community, giving advice on the promotion of health and the prevention of illness. The nurse role. The nurse role has changed considerably in recent years. In addition to general patient care, checking temperatures, pulse rates, and blood pressure, changing dressings, giving injections, and removing sutures. Nurses now do some of the things previously reserved for doctors, such as prescribing drugs or ordering laboratory tests. More responsibility for nurse is planned, as the following article demonstrating. Nurse carry out surgery in effort to cut patient waiting list. Nurses in Scotland training to perform minor surgery have entered the operating theater for the first time in an effort to cut patient waiting times. 5 nurses who have passed a new course at Glasgow Caledonian University are now qualified to carry out such procedure as the removal of small lesions, beginning moles, and cysts. The verbs perform and carry out are used with all types of procedure. They are often used in the passive form. Perform an examination, an operation, a procedure, an experiment, a test, a biopsy. Carry out an examination, an operation, a procedure, an experiment, a test, and a biopsy. The procedure was performed by a nurse. The procedure was carried out by a nurse. Thank you. Good night. I'm going to read the exercise. 7.1. Complete the sentence. Look at B and see opposite to help you. Someone who specializes in delivering babies is a midwife. Someone who is qualified to assist nurse is a nursing auxiliary. Someone who is not qualified but is able to assist nurse is a health visitor. A nurse who has qualified is registered nurse. A nurse who specializes in health promotion is a public health. A nurse who looks after a guard is a guard nurse. A nurse who looks in the community is a district nurse. Someone who answered the word in telephone is a receptionist. 7.2. Make word combinations using the word or phrase from each box. Carry out a procedure. Change dressings. Change a dressing. Check the temperature. Give an injection or remove suture. Complete the sentence with the correct grammatical form of perform. An isotope brain scan is painless and easy to perform. Biopsy of the pancreas was performed last March. If the patient condition deteriorates, a laparotomy should be performed. If a diagnosis of meningitis is suspected, a lumbar puncture must be performed. Last year, we performed a randomized double-blind group study. 7.4. Complete the sentence with the correct grammatical form of carry out. I now intend to carry out a large study. Unfortunately, few properly controlled trials have been carried out so far. A number of studies have been carried out recently to look at this question. A right hemicolectomy was carried out and the patient made a full recovery. The procedure can be carried out in the emergency department. That is it.